co-produced way with health partners. The next step of that will be to have more community conversations. You will remember we had some community conversations at the back end of last year when we were giving feedback on the plan, and one of those areas was around neighbourhood health development. We have a what we're calling a sprint, but in essence, what is a multi-agency workshop Thursday of this week, where we have around 90 attendees as professionals that work within our different organisations. So that's your acute trust, community services, primary care, local authority social care, local authority housing, local authority partnerships, as well as even Regen are coming, GPs, clinical directors, and we are really taking, I suppose, a spread of those organisations. So it doesn't just sit as a kind of strategic commitment. We're building that operational vision together for what neighbourhood health in Haringey may look like, taking a range of operational staff as well as leadership capacity. So we're having a big event in St Anne's Library, that great space we've got at the back of the library, where we'll start to turn what at the moment is sort of a bit of a vision and a problem statement into what could this mean for Haringey. And we need to be guided by the data and community insight that's coming from that, guided by what we are already doing. We've got brilliant examples in our multi-agency coordination team, and there's a video launching soon that I feature in. I do need some extra media skills training. But actually they are shining examples of what can be delivered when we work best together. That team alone saw a 40% reduction at A&E, social care benefits, and £1 million worth of savings to the system. So we've got really good foundations to build upon in Haringey, and we're starting that work with a or we're continuing that work because we have been doing it for some time, but we need to scale it up and be really clear what we can do within our existing resources, and in the hope that the 10-year plan is able to, I suppose, prime some activity, we will be in a good place to go first. And actually, we're in a good place in comparison to some of our NCL partners in this space.
Okay, right, I've got a number of hands now come up. So I've got Councillor Mason and then Councillor Benham.
Just be really quick. Thank you for all of that. And I think I completely agree that neighbourhood and health is exceptionally important. One of the big problems that some of us face is that there isn't a place or resource. A neighbourhood needs somewhere that people can get together, that there are services on offer, that there are things that people can do in their neighbourhood and support each other. In Bounds Green, that's significantly lacking, particularly in the more deprived half of Bounds Green. One half is quite wealthy and seems to get together easily. The other half is much poorer and doesn't have resources. So I'd really ask that you take that on board and have a look at it. I'm really happy to show anybody around the area, and I'm sure our councillor Arkell would as well. But it would be really good to have some focus on that area where there is a lack of resources going in. Thank you.
Thank you. I think it's a really supportive comment. You won't be surprised to hear that every time we talk about, when I'm in conversations which are about the community and the voluntary sector, those are the issues that I raise, because I can see that the future is leading into local voluntary sector, that we need to have all the structures and infrastructure in place that enable that. I think my personal view, everybody knows this, I think we're on a journey. I think I've worked in the voluntary sector for about 25 years, so I've got plenty of strong views on it. And I think it's a bit of a learning journey for us as local authority, in amongst some other really challenging pressures on us ourselves. But it's definitely on the table as far as I'm concerned.
And one of the sort of buzzwords and phrases you may or may not have heard that the NHS, I will quote rather than saying, but they're talking about shift left. So they're talking about how do we move from, I suppose, some of the acute into the community. And actually what we've been saying, and there's been absolute consensus, that has to include voluntary and community sector support as part of that. And that is, at the early identification, early support, early help, that being fundamental to this. What happens at the moment is there is some limited investment in that infrastructure from health. There is through some of our health inequalities program, but there isn't long-term stable investment in the sector in a way that I think we really need it in a partnership and systems level way to have long-term prevention. And we know we need to be, doing the complex kind of coordination and having, say, integrated neighbourhood teams, which is the sort of government's ambition. But we can only do that at the same time as doing the prevention to try and kind of close the gap in the middle. So one of the key areas that we are really pushing on is that we do need to think about the wider investment landscape and what that means in the place into the voluntary and community sector. And we do that as a whole, recognising that actually the social determinants of health and some of those factors are fundamental to the shift that the government and the NHS not only want to see, but that we need to see. So we are very strongly making that point and advocating for that. And really important for you to note that voluntary and community sector and some patient voice through our representative forums that we've got are in the room as part of our sessions. So they're a core part of the conversation. We need to do more on that and expand it out because it is more professionals led, and we recognise that. But Bridge Renewal, Public Voice, and a number of voluntary and community sector organisations are around the table for the conversations.
Hey, thank you. Councillor Brennan.
I was just interested in an update on the well, I understand from previous meetings we have locally less of a uptake, or we have less residents who get the continuing health care from the NHS, and I just wanted an update to see whether we'd made any progress on equalising with the neighbouring boroughs on that.
So I think that's right. I think it's very challenging, and I'm very happy outside of the space to share the FOI information, which I think showed that people in North East London were getting twice as much CHC. People in North West London were getting 3 times as much CHC. I think the same was South East London, twice as much, if my maths is roughly thereabouts. So you're right, it's a big issue. But we have done we saw quite a lot of positive impact on our budget, to be honest, last year, because we put in some resources on that. Joe, do you want to talk about that?
Quite the evening, isn't it? Yeah, we invested in some work looking in and around continued healthcare funding. How we did it, we looked at, we reviewed a lot of the residents that had more complex needs. So we actually, the way in to do the work was via reviews. And forgive me if you just give me 1 second, I've got some data on what the outcomes of that were. It was over £1 million savings that were made in the financial year. What was interesting around it was, I think as a borough, we had low numbers, and I think we also had an issue within the service around expertise in challenging some of the health professionals that tend to dominate those discussions, and the checklists that are submitted if you know anything about CHC. They're very technical, and I think health have tended to dominate that space in the past, but they definitely did here in Haringey. So one of the things we've been discussing within the service is how do we sustain the good work that team did so that we can grow and develop our kick-ass capacity in CHC, and that's what you need. You need your strongest people. It was interesting, in my previous borough we had people leading on CHC who were trained both as nurses and social workers, so they were really agile in those negotiations. Either way, it's one of our biggest areas of potential savings. And I think the other thing we've discussed with Sarah is really about how we manage escalation. So at the minute, there are many man and woman hours spent escalating cases and in dispute. I think we need to suck that all up into some sort of escalation panel, possibly chaired by myself. Sarah might need to dip in as well, just so that we've got clear lines of accountability. It'll be challenging because we're also trying to maintain relationships and grow the neighbourhood working and all the other things we do with our NHS colleagues, but it has to happen.
if I may come in just on on this as an area of increased risk, actually, because we know through the what they're calling the model ICB plans and the plans for the reduction on ICBs, there is still clarity needed in 3 areas, 2 of which I think you might want under the purview of this panel, and we might want to bring health partners in for a conversation. One is CHC, the other is safeguarding, and then the final one, which would obviously be for the children's panel, is SEND. The ICB at the moment play a significant role, some of that by legislation, actually, particularly in the case of safeguarding. And it is not clear what the plans are for the future for each of those functions in a revised ICB model. And I think that will be an increasing area of focus. Our ICB locally has been hosting a number of listening sessions, listening to local authorities and other partners around what our reflections are on the risks and opportunities in that space. But I think as we see those plans emerge, they are 3 areas of risk for us as a local authority, and we don't want to get into a place where effectively these changes act as a a further opportunity for cost shunting between NHS and local authorities. That's not the place we want to be in, and that will not, will then, as Joe said, when we're trying to deliver all of our ambitions on neighbourhood health, something like that could really undermine. So I think we need to see it as the opportunity to influence the future shape there, or how CHC could work differently going forward. And I think I've noted here before there is some work that ADAS nationally are leading in this space. I believe is supposed to report in July, August. So once that's out, happy to share that with the panel and bring back. I think it might be good to if the panel could help support a wider discussion on this. Actually, thank you.
So we have our Haringey Safeguarding Adults Board on the 22nd of September coming to the panel. Is that something that you think would be appropriate at that point, or is this a separate part of it? Because I know you said it's coming back in July and August. You obviously want to get a handle on where that leaves the council. It might be a case of you might just want us to pick up a couple of bullet points, or you might want us to take on bringing partners into that discussion. So it doesn't have to be an answer now. Sorry, I didn't want to sort of put you on the spot, but it's something maybe to think over. And if you could let us know, we could build that in to that agenda item on that part. Thank you.
Yeah, no, just I think you pretty much answered a lot of what I was going to ask about the ICB. But maybe briefly, I know my ICB where I work is changing going forward. Is there any plans for this ICB to change, to become bigger? And if so, could you give us an update on that, please?
I think it's in the public domain that there is a floating of an idea of a merger with another ICB. Give me and we heard about that at the recent Health and Wellbeing Board. The things that came up at Health and Wellbeing Board were naturally, as you might expect, how people can have a say. And I must say, it was very clear that the 2 boards will take the decision as to whether or not they merge. Obviously, the leader's the chair of the ICB at the moment. So that might give us some comfort, but might make others feel less so. And we know that there doesn't seem to be a lot of time for community engagement on it.
Yeah, absolutely. So I think plans are in train really, and we will hear soon. I think there's possibly a role not just for the panel, but also for JOSC, because actually these issues are obviously more than just Haringey Council. They span all NCL, and I think we really recognise for our ICB partners, they went through a 30% cut previously. This is now 50%. So I think something of that scale, with the responsibilities that they've got, even in a move to a more strategic commissioning nature of the orientation for the organisation, which is sort of the direction of travel, is really significant, and really to enable them to kind of continue to deliver. I think there is recognition that at that scale, joining forces with another organisation is likely going to be one of the only ways in which they can deliver something of that scale. And for us, we're really mindful of, I suppose, that there will be a period of uncertainty, and much more will come out over the next few months. But for us, ensuring that there is still, and the kind of diametrically opposed in some ways, neighbourhoods versus being much more of a sub-regional, an even bigger sub-regional structure. The connection to place will be so important, and us kind of advocating for that connection to place and how that does fit with a much bigger organisation. I think, yeah, we will absolutely be advocating for that, for all of the borough partnerships and the borough integration aspects that will be required to make sure that we do not get, subsumed into something much bigger that it is then hard for us to work in partnership and collaboratively. What I would say it facilitates is maybe much more direct involvement with the local providers and having a slightly different role within that space. What does that mean for our role as system convener? Question. What does that mean for the providers? And you may have seen from some of the language and the narrative that's out there is this term integrator, and that there's likely to be an NHS body that plays that integrator role at